The purpose of an oral thermometer is to measure the temperature of a patient in order to ensure they do not have a fever or a cold. This would be a result from a temperature that is not within normal range, which is 36.5 to 37.2 degrees Celsius. The oral thermometer contains a scale, a large backlit LCD display with location identification ability. It reveals oral temperature with options of Fahrenheit and degrees Celsius. The long metal instrument put directly in the mouth beneath the tongue to detect the temperature of a patient is known as the probe. The oral temperature can be taken within 2 to 6 seconds. The oral thermometer contains interchangeable probe covers to lower the risk of cross-contamination. These covers can be changed and disposed of just by a click of a button located on the top of the probe. Some safety considerations to keep in mind while using this device is to ensure the patient you are using it on is of age and doesn't have a risk of choking on the probe. Since children of young age have a difficult time remaining still, an auxiliary thermometer would be more effective. Something else to keep in mind is to not stick the probe too far into the patient's mouth, as it should be placed right underneath the tongue without any pain or extreme discomfort. The oral thermometer includes probe covers that should be used and disposed of after every patient, as it stops the possibility of cross-contamination from occurring.
A sphygmomanometer is used to take blood pressure to one's overall health, monitor effectiveness of medication, or to diagnose various diseases or abnormalities. There are 4 parts of a sphygmomanometer. 1 is the cuff. The cuff wraps slightly tightly around the upper arm over the brachial artery, and once the air pressure increases in the cuff, the artery's circulation cuts off. The second is the bulb. The bulb must be pumped in order to allow air pressure to increase in the cuff, and the air is carried through the tube leading to the cuff. Third is the valve. This allows the air to stay in the bulb to constrict the circulation of the brachial artery or release air out of the bulb slowly to measure the systolic and diastolic pressure. Fourth is the manometer. This is the part of the medical instrument that is read throughout the procedure to retrieve the systolic and diastolic numbers and pressure, which is better auscultated with a stethoscope. Some safety considerations are: 1. The brachial artery should not be constricted for more than 1 minute. 2. Ensure that the pressure is not taken with the cuff over the clothing to get the most accurate results. 3. Make sure that the cuff is not initially wrapped too tightly around the patient's arm, as it may get uncomfortably tight as the pressure in the cuff increases. And 4. Ensure that the pieces of the sphygmomanometer are sanitized before and after use.
The purpose of the stethoscope when checking vital signs is to assist in checking blood pressure. After the cuff is placed and inflated, the healthcare provider will be using the stethoscope to listen for the first and last beat, which is the systolic and diastolic pressure. Before using the stethoscope, it is necessary to wet the ear tips, diaphragm, and bell with alcohol swabs and let it dry before and after using it. And when placing the chest piece on the patient, ensure that it is not under the edge of the cuff because it will harm the patient when the cuff is inflated. The part of the stethoscope that is put into the user's ears is the ear tips. The sound from the chest piece travels to the listener through the ear tips. The ear tubes are the metal part of the stethoscope that connects the chest piece to the ear tips. Ear tubes are separated into left and right channels to allow for better sound and are also designed for minimal loss of sound. The tubing is a soft part of the stethoscope that allows for a better transmission of sound. The chest piece consists of the stem, diaphragm, and bell. The diaphragm and bell are designed to be non-chill, meaning it won't get cold, and hypoallergenic, meaning it will rarely cause allergic reactions. The diaphragm is the side of the chest piece with a larger circle. It allows for the transmission of high-frequency sounds and covers a wider area. The bell is the side of the chest piece with a smaller circle. It allows for the transmission of low-frequency sounds.
So I'm just gonna have you open your mouth and raise your tongue. And just close, but do not bite.
Okay, hi, I'm Julia. I'm just going to be taking your heart rate today. So, I should just show it. Go.
Okay, hi, my name is Erica. I'll be checking your pulse today.
And just say today I'm going to be and we'll do that. No, not for this one.
Okay, that's it.
Go.
Hi there, my name is Kevin today. I'll be your nurse. How are you? Good. So today we'll do some basic procedures. All right. Hi there, my name is Kevin. Today I'll be your nurse. How are you today?
Working on chemistry again. Okay, because I spoke in front of class the other day about this, right?
Tight is good. Doesn't hurt, does it? Alright, that's good.
Really high care.